Hey guys, good afternoon. How are you guys doing today? So today I have a very special guest with me, guys. It's Dr. Tamer today. He's going to be answering some of our questions, you guys. And I am so excited to share all of this information with you. And also, any questions that you guys may have, you guys can put them in the chat and I'll be reading them out to Dr. Tamer. So that way we can go ahead and know the answers to our questions, okay, you guys? And by the way, leave your information right here in my left bottom corner in this blue folder right here. Put your name, your phone number, and your email to get scheduled for a free virtual consultation with Dr. Tamer or a free in-person consultation, you guys, okay? Remember, right now we have amazing promotions and lots of specials that you guys got to take advantage from, okay? For everyone joining the live right now, hey guys, how are you guys doing today? Good afternoon. I hope everyone is having a loving day. So let's start with our questions. So Dr. Tamer, what happens to the belly button during a tummy tuck?
So depending which type of tummy tuck you get, which we'll probably go into a little bit more detail about that, but my goal is always to make sure the scar on the belly button is as small as possible. Usually we have to cut around it. Now, depending on how your belly button is situated, sometimes we have to give a little bit more. Typically after massive weight loss, the belly button's a little bit more pliable, so sometimes the scar can go around a little bit, but to me that's always a sign of a tummy tuck. So I take as much care as I can to make sure that there's as little scarring around it as possible. However, as with every surgery, they're gonna have some scarring, but the idea is to make it as small and as not noticeable as possible.
Of course. Can hypertension and diabetes disqualify me from getting a BBL?
So those two specific medical conditions can kind of stop you from any surgery. The main thing for me and most of your surgeons, I would assume, is making sure that you're as safe as possible. And hypertension can lead to some complications. The medications related with hypertension can lead to some complications. So those are definitely conversations to have with your surgeon, whoever's going to be committing your surgery directly, just to make sure that everything is being done to make sure that you're in the best care possible. Diabetes is another one of those that can really hamper healing and kind of make it so you're at more risk of more potential complications down the line. So those are definitely serious things to discuss with your surgeon. They don't disqualify you from every case, but depending on what level your hypertension is or your diabetes are, there are some cases where I would suggest people not undergo surgery.
Should I stop taking birth control before my surgery?
So yes, you should. So I'll never tell somebody when to stop taking birth control. However, it is important if you're about to have surgery that you stop birth control. That means if the birth control was serving a purpose, that you also take that into account, because the ramifications of it and hormones in general can cause blood clots, can cause DVTs, can cause a number of different things, and for that we want to make sure again that you're set up the best you can be for surgery. And so sometimes those things contradict. So yes, I would recommend stopping your birth control.
How long does it take for tummy tuck scars to fade?
This is a great question. So scars go through a process of healing, and as you'll notice, the first couple weeks after surgery it'll change quite a bit, quite dramatic, the first few weeks, and then slowly it goes through more changes. Even after the first 6 weeks you start to notice the scar going through some more changes. It can take months for it to heal, like in terms of when it starts to fade. I always try to tell people to stay out of the sun for the first 8 months, because as it goes through the transition process and the changes, and it goes through all the stages that it goes through, that's when it kind of regains its most natural-like appearance, but it still takes time after that. So the first few weeks you want to avoid anything that's going to stretch it, put strain on it, put it obviously no sunlight, don't get it wet. And then after the first 6 weeks, 8 weeks, you start to notice it gets a little more strength to it. At that point you can start to do a little bit more, but you still want to keep it out of the sun, to decrease the cosmetic changes of the sun. And then during that time is when you probably apply sunscreen. Now everyone's a case by case basis, obviously, depending on what your skin condition is, what surgery you had, but rough estimates in those terms. And, you know, your surgeon will give you kind of a little bit more detail on what they want, because most of it's through experience that we learn little things, little tricks. Florida is different than Ohio, is different than Hawaii, different than California.
Of course.
So we learn things along the way.
Of course. So I see lots of people are joining the live right now. You guys, any questions, any doubts you guys may have, put them in the chat. I'm going to be reading them out to our lovely doctor, and he's going to be answering them to you, okay? So here I see a question. Do you perform paniculectomy? Oh, wow.
So paniculectomy is essentially a surgery that is similar to a tummy tuck in the sense that it's a removal of skin. In specific, the paniculectomy refers to the area kind of below the belly button and down towards the pubis area, kind of that area between your waistline and pubis. A paniculectomy itself is different than a tummy tuck because the tummy tuck involves going all the way up past the belly button, suturing the muscle closed, whereas a paniculectomy is just a skin procedure. Some people will say that they want a paniculectomy, but you have to remember, if you don't do anything with the belly button, whatever you do to the skin below it, you're kind of pulling everything down. So some people end up with the belly button skin overhanging as you pull it down because you haven't readjusted the skin above the belly button. So I do them. I would say that it's rare to find people that should have a paniculectomy versus a tummy tuck, though there are some that have. Basically, this is reserved to the patients that have just a little sliver of extra skin below the waistline, more so than a lot of empty skin. That's where I would say the difference is, but I do perform them. It's just, you know, making sure you're the right candidate so that your results look as good as possible on you.
Of course. Here I see someone ask, are we discussing plastic surgery? Yes, we are, love. I see your name here. Sia Bia, I believe. We are discussing plastic surgery, and I believe someone said I had weight loss surgery, got extra skin below my belly button. So I believe this is the same person that asked you if you do...
So I would say...
Lost 140. Oh, wow, great.
Congratulations, first of all. Weight loss is a huge battle for people. And I'm happy you were able to do it. And I want to give you those kudos first and foremost. That said, I've dealt with weight loss, a lot of patients. And as well as you feel, as your body starts feeling better, it's almost like your full transition isn't until you get rid of the skin. It's almost like it's a process. And for the patients that I've seen, they don't feel like it's complete until that process is complete. And it's hard because you've accomplished so much with that weight loss. Like, that's incredible. But from most cases, and I'd say for your specific case, send us your pictures, we'll take a peek. But for most cases, when you've lost that much weight, if you can imagine taking off all the skin, if you're making it so that the skin is tight, then you're probably having to pull too much skin down to where it would, what we call hood over the belly button. And so that's where I would say typically you're going to need more of the tummy tuck abdominoplasty, as we call it. But I would defer to waiting till I see your specific case.
Of course. Here we have a question that says, I have stretch marks on my lower tummy, but I've never had kids. Can I do lipo or not a tummy tuck?
So liposuction, the way I always view these things is kind of like better understand what to communicate with your surgeon. Liposuction is just removing the fat that's between the skin and the muscle, right? So we don't go below the muscle. The tummy tuck, abdominoplasty, that's to remove skin. So do you remove some fat with skin? Sometimes, yes. But stretch marks aren't going to go away with liposuction, right? Because I'm not removing any of the skin. Now, depending on, how your skin is health-wise, how you are health-wise, how your nutrition is, how long the stretch marks have been there, is it possible that if you remove the fat that you can potentially get rid of the stretch marks? I would say in most cases I've seen no, because stretch marks are usually irreparable damage to the skin. However, I'm not gonna, guarantee that they won't go away. But the only sure way to get rid of stretch marks is to remove them in skin procedures. Now, there's a little caveat to that, because there's only so much skin you can remove, right? And so if the stretch mark ends up within the scar itself, then the scar can widen a little bit too. So again, those are really good conversations to have with the surgeon that you choose, because there's just so many little nuances to each individual person that you can't really go into on a broad sense and then make people feel like, you know, I'm doing right by them. My main thing, as I said, with these lives, it's to introduce people to it a little bit, to kind of give broad generalizations, but for most of these things, it's just best to discuss strictly with your surgeon.
Of course. So I see here we have a question that says, if you don't get RF with lipo 6 years ago, is it too late to get RF to shrink, wrap the skin to abs?
So the nice thing about radio frequency, and there's a couple different devices out there on the market that do radio frequency, they all do similar parts, but the idea, to simplify it, is basically the radio frequency creates a current that essentially heats the tissue to the point where it causes it to go into the tightening phase. Now, the body normally, when it goes through the healing process, the first part with the liposuction is you're removing the fat, then you're tightening the skin. If it's all happening at the same time, then as the skin and the tissues are healing, they're also tightening. If you've already been 6 years past, you've already gone through the phase. The tissue that has had the liposuction on it has already gone through the healing phase and is pretty much healed back to full strength. So then there would not really be the advantage of doing the radio frequency. Now, doing radio frequency alone has some effect. I'm not going to say it doesn't. But it's less when it's done without concurrent surgery. So I think in terms of, is it too late? No, it's never too late. Is the result better if it's done at the same time typically? That's how I kind of answer that.
So here I have a message from Xenia. Hey, you guys, I just sent over my reevaluation forms over to you guys. Oh, wow. Thank you, love. By the way, you guys, the way that you can leave your information so that way we can schedule you for a free virtual consultation or a free in-person consultation is by leaving your information right here, you guys, in my left bottom corner in this blue folder, so that way we can get you your free consultation with Dr. Tamer. Okay, you guys? Thank you so much for all those amazing questions. And by the way, any questions, any doubts, leave them in the chat, you guys, okay? I see someone here said, is that only called J-plasma, or are there other names for lipo plus radio frequency procedures?
Depending on which company, it has different names. Each one says they have different features. I would say that usually typically offices will use one or the other type of radio frequency, but they're all a little different, but they all have various similarities.
So I have a question here that says, is it true that I'll see the best results from my BBL around 2 months post-op?
Best results. So it's a little weighted question. The results are going to continue to change. I tell people when they're with me, the first week it's going to look very different than this. First day is going to look very different than the end of the first week. It's going to look very different than the end of the first month, very different than the end of 2 months. It will continue as it gets through the fluffing stage and as it gets through the kind of settling into shape phase. And depending on how often you're massaging, how often you're making sure to avoid sitting on it, the changes will take place over a period of 6 months to a year. Now, in the time after that, your skin is still adjusting, right? So there's a lot of changes that happen throughout the first year post-operatively. But I would say, obviously, you're going to notice more changes week to week in the first month, and then slowly it's going to be longer and longer in between. But I would say you're going to notice changes probably at least until 6 to 8 months after surgery. But again, it's kind of different depending on how much you've had and how your healing is and how your kind of massages are, your post-op recovery. But you're going to notice more of a difference in the first month than necessarily the fourth month, but you'll still notice some changes.
So I see here that we have a question from Zena. When does the fluffing stage usually happen?
Kind of depends. I know that's kind of like the cop-out answer, but I hate to tell people when to expect certain things to happen because everyone's a little different and it makes people a little bit more anxious. Usually around the 2 month mark, roughly. But it can happen sooner. I mean, I've seen patients where it's post-op day 7, and I'm already see some of that. And then I've seen patients where it may be 3 months, 4 months down the line, where it's like starting to really take place. So, again, don't hold yourself to the numbers that are out there. Just make sure that you're doing everything, you're following up with the post-op procedure correctly, and your surgeon will help you guide through that, and as will your post-operative assistants and your nurses, PAs, NPs. All those people are such a huge help to listen to.
We got your back, you guys. Here at Icon Cosmetic Center, we help you with absolutely everything, okay, you guys? Here we have a question from Ex Diosa. Is there a lipo plus fat transfer procedure to match your thighs to your previous BBL results? So I believe that, do you match her thighs if she's had a BBL somewhere else?
Tough to say, because the body's in segments, right? And so if you put fat in the wrong spot, then it looks odd. And so that happens in future. Like if somebody's skin starts to drop a little bit and they've lost some volume, then their skin starts to sag. So you wouldn't necessarily want to put fat underneath it to try to make it look like a butt, because then that doesn't necessarily look natural. So it's kind of a bit of a, depending how you look, an aesthetic, a cosmetic surgeon, a plastic surgeon will be able to look at it and determine what the best. Sometimes you need a body lift to kind of piece everything back together. Sometimes you may need a little bit of liposuction to give you more contouring. Sometimes you may need some fat injection to the hip dips just to kind of make sure the contour just a little bit more aesthetically pleasing. But it's kind of, definitely don't want to give a general to that one, because it's really dependent on what is causing that mismatch that you may have, to see what would be the best way to make it more aesthetically pleasing.
Oh, look, doctor, they just sent you 5 hearts.
That's a heart.
Yeah. So on TikTok, people can pay to like send you gifts and hearts and stuff like that. So that's basically what they're doing.
Thank you guys, I think.
Yeah. So we have a question here from, when can you sit after a BBL? Look, there's keep sending hearts.
Long time. And that's the hard part. I mean, I like to say I'm in the OR probably with BBL roughly 3 to 4 hours. That's it. And you guys are dealing with the post-op stuff for 6 weeks, 6 months later, right? And it's hard to sometimes remember how much of that goes into getting the best results possible. So I would say at least 6 weeks, but upwards of 2 months isn't unseen. It's kind of like when people ask me how long do I have to wear my faja? Technically 6 weeks, but if you take it off occasionally after that, but you wear it to kind of give yourself, you're still going to keep getting better results. So I hate to tell people like when they can start to, but really I would say follow the post-op instructions, listen intently to your surgeon. You put a lot of effort into it. You're working really hard to get the best results possible. View that in the short term and the long term. What I mean by that is schedule your surgery when you can do it. Don't try to force things to a certain time frame because it's convenient and then kind of get haphazard results because of that. The main thing for everything is going to be your post-op and how you're able to follow those instructions, because there's a reason we kind of make those.
Of course. How do you help patients choose between saline and silicone implants?
Okay, so there's another one of those patient dependent, but for the most part, I would say now upwards of 90 to 95% of my breast augs are going to be silicone, because they feel more natural, they're a little lighter, they look more natural, they're less variability in filling it. So like, with the saline implants, you're filling it, and yes, you're planned to be exact, but it's still, there's a chance for human error, whereas with the silicone, they're made, they're designed by the company, they're filled, they're manufactured to be a certain size. So I would say all those things taken into account, they don't have as much capsular contracture. That's another thing. They they don't have as many of the, like, they don't burst as much. So there were in the past some more risks associated with it. Since then, those have kind of been decreased, and so I would say most patients I would go with silicone. However, we do have occasional patients that still want saline, and so I would go patient to patient basis on that.
Of course. So here we have someone that sent you a rose. Very nice. Thank you so much, you guys. So the next question is, what is the typical recovery time for a mommy makeover?
So this is a little bit of a weighted question. A mommy makeover is basically a combination procedure. It combines a couple of different procedures together. It could be a breast lift with a tummy tuck. It could be a breast aug with a tummy tuck. It could be a back lift with a thigh lift. So there's a number of different procedures that could go into it. For the most part, I would say 8 weeks of, just in general, 8 weeks is about the time frame when the muscles are beginning to heal appropriately to where you can kind of go about your day-to-day. Now, again, that's a general statement. I would say that's a big disclaimer of, per surgery, per outcome, per patient is very different. But in a general front, I would say about 2 months, depending what exactly procedures you had done.
So here we have someone, Tay80. I got my surgery day already. Hurry. I can't wait.
Is that with me?
Oh, wow. Yes, that's with you.
Oh.
That's with you. Yeah, she's letting us know that she cannot wait.
Yeah. As I said, I can't talk about most of the stuff because of hip, so I just try to avoid, but thank you.
So, what are the most common areas of the body for liposuction?
Oh, okay. So I view the body as a whole kind of when it comes to liposuction already. And so most people will get the flanks done for sure. Everyone asks about their abdomen, but you can't really do the abdomen without the flanks. And then when you talk about the abdomen and the flanks, you can't really do the flanks. Now the flanks, if you're looking at a body, so you got the front, back, side. So this part would be the flanks. If you're doing the flanks, you're going to have to do the lower back too. So it's like, I view it more as a unit. There'd be very few times where I do liposuction to the abdomen and flanks and not the back. Very few times I do it to the abdomen and not the flanks. So I'd say those are probably the most frequent. Lesser known places that people get liposuction is the chin, thighs. A lot of people, the arms, back of the arms, especially with the radial frequency to get a tightening. People that don't want that big scarf for the brachioplasty will get that. Same with the thighs with the tightening to kind of avoid the big scar. Even though for the minor thigh lift, that's just the inner thighs, you can get that scar that kind of hugs the inside of the thighs pretty well. Chin lipo works really well. Those are probably the most main areas, and then some of the main less known areas.
Yeah. I believe someone asked, how long does healing take for a BBL? So you guys, for a BBL, it really differs, because not everyone's body type is the same. And as the doctor was saying earlier, it is good to get tips and recommendations from people, but it's also good to remember that your healing process is not going to be the same as everyone else's, you guys, okay? So it's extremely important that you remember your blood circulation is different, your skin type is different, your body is different, so it is super important that we remember. But if you're asking for when can I return back to the gym, or when can I start sitting down, after 6 weeks, you guys, right? After 6 weeks after a BBL, around there, yeah. Roughly. But if you can give yourself some time to heal a little bit longer and to listen to our body, because we have to remember that these are brand new fat cells that are being put into our buttocks, and we have to allow the body to heal and to accept those fat cells, you guys, okay? So I believe, okay, thank you. No, of course, we're here to help you out, you guys, but it's really important that you do remember that not everyone's healing is the same. So it does play a part, okay?
Yeah, my main goal in doing these is just to have these conversations, let you guys kind of have an idea of what we think of from the surgery standpoint, and, how we'll hopefully improve the communication, because ultimately I believe that's what gets the best results, is when you have that open communication with your surgeon. You discuss exactly what you're looking for. Like if you show me a picture and you say, look, this is what I want. I'm going to tell you, like, hey, that's probably not the most realistic. We're probably not going to be able to achieve that. We might be able to achieve this. And it's kind of that give and take. And I'm going to always be honest with you. I'm never, I'm not somebody who wants to convince you that you want this or convince you that this is going to work. I'm going to tell you what's possible, what's realistic. And, hopefully in that conversation, then we get to the point where the expectation that you have is the result I can give you. And then I can tell you how to maximize that result after surgery. What do you have to do in the post-op area? What can you do to help this result? Taking a little bit more protein. Should you lose weight before surgery? Those are the conversations I want to have. Obviously, each of them is going to be personalized to you, right? I'm not doing surgery on as many people as we're doing this live with. I'm not doing surgery on 22 people at the same time. It's going to be a personalized surgery to the patient. And so each person's instructions, each person's post-op changes. And so that's the part I hope that we get to. This is more so we, in the conversation, if it spurs something in you that you want to ask your surgeon because you heard about it, not so much as a piece of advice, but say like, oh, okay, this person does this, how do you do this? Then it already opens up that conversation for you to have that with your surgeon so that you know what the expectation is. Because sometimes, not everything is mentioned. So like, I get a random question, probably at least once a week where I'm like, wow, I never thought about if somebody could go see doing a couple weeks after. So like those little things that may come up, it just always helps to have those conversations with your surgeon.
So here you've been receiving lots of gifts. You've gotten 10 roses. You've gotten a couple finger hearts, friendship bracelets. And here we have a question that says, can you get it done if you're young, or do you have a minimum age, I believe, for a BBL? If you're
so I would say there's a minimum age for surgery, 18 to sign consent.
18.
There's a minimum age for breast aug 21s to get the FDA, but again, 18 is kind of the surgery for consent. For a BBL, I wouldn't say there's a minimum age. I would say that your body's going through changes. And so it would be kind of like you don't want to necessarily do a breast reduction before your 18th birthday, before you probably usually 20s, because your body's going to change so much. But there are instances where you would do them. But for the most part, I would say your body's still undergoing a number of changes. And you kind of want your body to complete its changes before undergoing something that's surgically changing your body. Because if not, then your body's going to continue to change after surgery. So that's just going to mean that in spite of what your surgeon and you are trying to accomplish, your body's going to change it. So you might end up spending X amount of dollars and then come to find out that you don't really have the surgery result you wanted because your body's still changing.
Oh, I get you. Thank you. No,
of course. That's why I'm here.
Yeah, of course, you guys. Can pregnancy undo the result of a tummy tuck or mommy makeover?
Yes, ironically, because we're trying to improve upon some characteristics, and sometimes those improved characteristics can lead to more pregnancies. We try to tell people to kind of have their pregnancies completed prior to these surgeries, because as you can imagine, if I do a tummy tuck and I tighten up the abdominal wall muscles and then you get pregnant or the patient gets pregnant again, abdominal wall muscles have to stretch for the area for the baby to grow, and so that can obviously impact the result. So I have seen that where people get a tummy tuck and they have a kid, and the abdomen needs another plication, which is the tightening of the muscles. Also with breastfeeding, same thing.
I finished your gallery. I'm here to support the practice. I hope I could help. You are all amazing. This is a person that's been sending you lots of gifts the entire life.
Thank you.
Yeah. So here we have a question that says, is it necessary to get implants for a breast lift?
No. So 2 different surgeries goals with those. And people often combine them because they have 2 different goals. So the lift is done when the areola and the nipple are below a certain point. And the lift is done strictly to move the areola complex back to where it's supposed to be in the more aesthetically pleasing way. I say supposed to, I mean kind of more to the what they call the youthful breast area. Whereas in augmentation is what they call the youthful breast area. Whereas in augmentation is done to augment or change the size of the breast and to add more volume per se. So they can be done separately, they can be done together, but they are two very different procedures.
Do you recommend implant size based on the patient's weight and body type? Does this same apply to BBLs?
One thing, especially if we do more of these, if I'm invited back on, I don't know, I might be too long-winded, I don't know. But I'm very much your body changes my surgery. And what I mean by that is the process is the same, the steps are the same, but ultimately your body is going to dictate what I can do and what I plan to do. And that's going to be the conversation during the consult. Is essentially I'm going to formulate the plan towards what is specific to your body. And part of that is for breast augmentation, measuring the diameter. We don't want to put a breast implant that is this big in a chest cavity that's this big, because multiple things can happen, including complications, but also it can drift to the side if we pass that natural delineation that your body has in the chest cavity. So it's all about knowing your boundary, like me knowing my boundaries, and understanding how it relates to the rest of your body, making sure that we don't put something that is overly big or going to cause complications. And the same goes with the BBL. Some people aren't going to have the natural body structure to have the changes that somebody else can. And so to answer your question, yes, I take that into account a lot in terms of what can be accomplished and what we discuss with the patient.
Okay, so I see here, yes, please explain why you guys don't lipo the armpit area. You can lipo the armpit area?
Right here, sometimes I'm not sure exactly what you mean by armpit area. There's different restrictions and borders in the armpit itself. But like a lot of people will get the area up here, the area ball line up here. So it just kind of depends what
like
exactly area you're looking for.
Yeah, we do that here, you guys. After a tummy tuck, how long after should I wait to get a 360 lipo?
So that's a complicated question a little bit, in the sense of after a tummy tuck, you want the blood obviously to heal, the blood vessels, the flap that creates, you want the scar to be well healed. Your body's going to change after any surgery for at least 8 months. So for the most part, I would say wait the 8 months, just so your body, your swelling, all that stuff can get better. But that said, it's kind of also depends on your goals. Like if you were planning to get a tummy tuck because your tummy had extra loose skin, but you also wanted to get the back lipo sooner, then that's not having as much impact as a lipo to your flanks and abdomen. So again, depends on the surgeries, what your ultimate goal is. But your body, just remember, if you kind of remember, your body's going to be changing for 8 months after surgery. You kind of take that into account with what your goals are, your realistic goals are, then you'll be able to make those decisions a little bit easier for yourself.
Here I see my schedule's BBL and tummy tuck. Any recommendations, please? So she wants to get a BBL and a tummy tuck at the same time, and she's asking for any recommendations.
Recommendations for what?
For a tummy tuck and BBL. If you could be a little more clear on exactly it is that the question is, you guys. So how long after the surgery do I go home, and why do surgeons only do natural bodies?
So I tell people usually 6 weeks you want to stay in town for the course of your post-operative treatment, because that's as long as, if anything comes up, I can help you, right? It's hard when you're far away. I'm kind of a control freak in that sense. I like my patients to be in the best hand possible, and like for us to go through those things and have those discussions.
We care, guys. We care.
It's a surgery. A surgery is a surgery. It's still a risk. It's still, you know, there's still inherent risk in surgery. So we just want you to have the best possible outcome and the safest possible outcome. As far as why do people do natural outcomes, I would say my goal is always to have you be told you look better, not necessarily who's the surgeon you went to. Something looks different, you know, wow, you've really toned up something, not so much like, oh, who's your surgeon? Now, if you want to share, who I appreciate it, but I don't really think that I wanted people going around saying, oh, like, who did that? Like, I know you had surgery, you know? Now, some people will ask me for those, few and far between, but I'd say for the most part, the results are a combination of the expectations of the patients and what's realistic. And so sometimes I would say that's probably going to give you your natural looking result.
So I see here she's 6 weeks. I'm in Orlando. So no, love, you have to stay in the city of Miami at least 7 to 10 days so we can do follows with you. You don't have to stay in the city like 6 weeks. But what the surgeon is saying here is that it's super, super important for us to be able to do follow-ups with you guys. That's why, for example, we have iconic dolls worldwide. You know, we receive people from outside of the country and outside of the state all the time, you guys. So it's important that you guys remember, for example, if you're getting a BBL with Dr. Tamer, for you not to just board a plane 2-3 days after your BBL, you guys, because like he was saying, it is super important for him to be able to see you and see how your body's doing, see how you're doing, how those results are doing. Are you drinking enough water? Are you walking every hour, 15 to 20 minutes, you guys? All of these things, eating high in proteins, getting your massages, all of these things play a part, and it, you know, it makes the surgeon have peace of mind to be able to see you and see how you're doing, you guys, okay? So that is really, really, really important, okay? So I see someone here put, I want lipo and lipo only. What do you know? What do you want to know about liposuction? Let us know. What do you want to know? I see here other people.
I think I get it.
Yeah, but we're finishing up, you guys. We have 2 more questions here for Dr. Tamer, and that's it, you guys, okay? So right now is the time.
If she invites me back, I'll be back.
He's going to be back, you guys. You don't see how amazing he is? This is our very, very special surgeon here, okay, you guys? So, here I have a question that says, what happens if a patient doesn't have enough fat for a BBL?
So enough fat is a relative term. I would say that most people have enough to at least get what I would say is a skinny BBL, where you don't inject as much fat, you just inject it into the right places. It's like a skinny lipo. I may not take as much fat out, but it's about contouring. And I tell patients this, like, some people just want the fat out, other people want the contour of the lipo. And both are doable. It's just different strokes for different folks, as they say. And so basically, if you have some fat, depending on what your ultimate goals are, then we would likely be able to inject it into contour your buttocks. Now, there are some people who have too much ptosis or droop in their buttocks, where the volume of their fat won't be enough to fill the buttock enough to do that. Well, for that we do a trunk lift. So we're actually cutting the skin off the top and lifting the buttocks that way. So everyone, I like to say there's always multiple different possibilities that we can do to help you with the results you're looking for, as long as we're on the same page of what the expectation is and what's realistic. And I would say, as long as that communication happens, then we always have some options up our sleeve on what can be done.
Of course. So here they're coming in hot with the questions, you guys. Our surgeon has to go, so I'm only gonna read 2 more questions, and that's it, you guys. What's your BMI limit?
So it depends on the surgery, and depends on the combination. Now, under 30 is going to be the safest in terms of having tummy tucks, breast lifts, breast reductions, and the reason for that is going to be because of your risk of clotting. So under 30 is always the best. Now, there are certain procedures that under 35 has a little bit more leeway, a little bit less safety concerns. Those are going to be kind of surgeon to surgeon, area to area, but also what other comorbidities or health concerns or previous surgeries have you had. So those I take on a case-to-case basis. So but you typically want to stay around that 30 number.
So here we have a question. This is the last question, you guys. Are you located in Orlando? No, we're located in Miami, Florida, but we can schedule you for a free virtual consultation or free in-person consultation with our lovely Dr. Tamara, okay? You guys, there's no issue in that. We have iconic dolls internationally, you guys, okay? So we can always agenda you for virtual free consultation, okay? So the last question is, can I get J plasma to reshape my glutes after a BBL? Not a BBL reduction, just the bottom part. It's no longer round in the bottom. Yes, I'm ready. Vanessa, leave your information right here in my left bottom corner in this blue folder. Name, phone number, and email, okay?
So,
go ahead, doctor.
Not sure what you mean by BBL reduction, but a BBL with J plasma, getting into the...
Sorry to cut you off. You put your phone number in the chat. There's a blue folder right here, okay? There's this blue folder right here. Click it, put your phone number there and your name and your email, you guys, okay? Not on the actual chat, on the blue folder in the left bottom corner. Go ahead.
So, that's an interesting question, and it's a good question. I would say that is one of those that is really specific to certain scenarios where you can actually use different devices to help with the radio frequency, and depending exactly what you're looking for, it could be possible. It's a little bit more of the special circumstances though than the norm, but I'd be happy. I'm sure a lot of surgeons would be happy to take a look too and kind of go from there. If that's something that you're interested in. I think that person was already having another surgery, so I mean, whatever it may be in the future, but yes, there are some certain possibilities, but that is a person-to-person basis and surgeon preference for sure, and so I would leave that as I'd have to see it to kind of give you more information.
Of course. Well, thank you so much,
Absolutely.
Dr. Tammy, for being with us here
Thank
today.
you
You're amazing.
Time. Appreciate it.
And
thank
you guys, thank you for all those amazing gifts. They gave you lots of gifts,
Thanks.
Doctor. Yeah.
And let her know what else we can answer. This way, even if I don't have necessarily time to go on live, we can have these conversations. We can keep the communication open, and maybe one more we can do.
You're amazing,
Thank
Doctor.
you guys.
Thank you so
very much.
Thank you for
Excellent host. Give her the kudos.
Amazing surgeon. Thank you, surgeon. Bye. So, you guys, any questions that you guys may have, I'm here to let you know Dr. Tamara is ready to receive those free virtual consultations and those free in-person consultations. We have lots of people already booking up, you guys. Here I see you guys are putting some clapping emojis. Thank you so much, you guys. That means the world to us. It's really, really, really helpful for us to be able to communicate with you guys and to answer all of those doubts that you guys may be having. And we're here to help you all, you guys. We're here to guide you. We're here to educate you guys as much as we possibly can. So it was so amazing that you guys were putting all your questions and all your doubts in the chat, because like I said, we're here to help you out, okay, you guys? By the way, for the people that were trying to leave their information here, I believe her name was Vanessa, her and everybody that's listening to me, leave your information right here in my left bottom corner in this blue folder, you guys. Click it. You're gonna be putting your name, your phone number, and your email. That way we can get in contact with you guys. I'm here to let you know that we have lots of amazing promotions going on right now where your $250 deposit can be getting multiplied times 2. So now you don't have a $250 deposit. Now you have a now you have a $500 deposit that is going to be going towards your surgery. And let me tell you something, that applies for every single surgeon and for every single procedure. So if you've been thinking about getting your BBL, if you've been thinking about getting your breast augmentation, your tummy tuck, your liposuction, your mommy makeover, your vaginoplasty, your labiaplasty, I'm here to let you know, you guys, that right now is the time, right now is the day for you to finally step up and finally get your surgery, okay, you guys? So I'm here to also let you know that we have amazing financial plans going on right now that I'm going to be sharing with you in just a second. So, by the way, we're located in Miami, Florida, you guys, but we do have free virtual consultations and free in-person consultations. So, if you're watching me right now, you're loving our work, you're loving our surgeons, I did my $500 deposit and got my surgery date already. Oh my gosh, I am so happy, you guys. I am extremely, extremely happy for you. You did right, girl. You did right coming to us here at Icon Cosmetic Center. Trust me, you're going to be in love with those amazing results, and you're going to be so happy and through the roof, and you're just going to be so proud of yourself that you chose us. I'm here to let you know that it's not every day where a clinic like Icon Cosmetic Center, it's a very high volume clinic, All of our surgeons have over 10 years of experience. All of them are board certified, you know, and it's not every day that a clinic like our clinic is gonna be having you know, such amazing promotions and deals, especially considering our surgeons. Like, our surgeons' reputations are impeccable, you guys, okay? I'm here to let you know that our feedback, our reviews, our reputations as a whole, as a staff, as surgeons, as a clinic, is really untouchable, you guys. And you can see it for yourself. You could go to Icon Cosmetic Center on our Instagram or here on our TikTok. You know, we really love to be transparent, you guys. And, you know, we post our patients' testimonies. We post our iconic dolls before and afters. We post them speaking and talking about how their experience was, how are their results, what did they like, how did they like the results, how are they feeling, what are they doing, how did they feel with us here, how did they like our care and our treatment towards them. And I'm here to let you know that it's all smiles over here, you guys. So I'm here to let you know that if you haven't yet and you've been looking for a plastic surgery clinic, you know, you've been looking for the right clinic for you, you've been looking, trying to find somewhere where, you know, you can finally find something where you're comfortable, they're gonna give you good results, they're gonna treat you well, they're gonna take care of you, they're gonna prioritize you and educate you and always make you feel heard. Well, I'm here to let you know that Icon Cosmetic Center is the right place for you guys, okay? I'm also here to tell you guys about these amazing financial plans that I cannot wait to share with you, because this truly changed the game for us, okay? This completely changes everything for us. So let me get started. By the way, the financial plans that we are offering here at Icon Cosmetic Center, the companies that we do these financial plans with are Alpha on Credit and Care Credit, you guys, okay? So the financial plans are the following. For a BBL, you can pay as low as, what's your name? I want to add you in my post. Oh, thank you so much, love. My name is Penelope. I'm the brand ambassador here at Icon Cosmetic Center. You know, I do content for our lovely clinic. I do the lives. So, you know, you're always gonna see me here doing lives with the surgeons and, you know, talking about everything that we can possibly educate you guys with. And thank you so much, you know, for keeping me in mind. Thank you so much. My name is Penelope, okay? So, by the way, you guys, the financial plans are the following, and the companies that we do these financial plans with are Alpha on Credit and Care Credit, you guys. So I'm here to let you know that if you haven't yet, sign up, okay? Because time is kicking, and you know, you gotta be taking advantage of these amazing promotions, because it's not every day that you're gonna get promotions this good with a clinic this amazing, okay? With surgeons this great, okay? So leave your information right here, you guys, in my left bottom corner in this blue folder. Put your name, your phone number, and your email. That way we can get in contact with you guys, okay? So the financial plans are the following. For a BBL, you can pay as low as $29 weekly or $129 monthly, you guys. You know how affordable that is? You know how affordable it is that you can just pay $29 weekly or as low as $129 a month? Like, you guys, I'm letting you know right now as we speak. You know, we have daily expenses like food and gas and groceries and clothes and shoes and nails and stuff like that. And I am here to let you know that it is not every day where you can literally finance your BBL or your surgery, you know, because I haven't even gotten into the rest of the financial plans, that you can finance your surgery this affordable, this inexpensive, you guys, and in no time you'll become an iconic doll. In no time you'll have your new banging body, you guys. So I'm here to let you know, you guys, that the time is now. I see here, give me an example for a full lipo, not adding or removing anything. So basically, a full lipo, it would be a lipo 360. And a lipo 360, what it basically takes place is the following. So let me explain. I believe, wait, this is not even what I'm trying to do. My blazer was a little weird. Okay, you guys, so the lipo 360, where it takes place is your whole front abdomen area. So your whole front abdomen area, you guys, your flanks, you know, your love handles right here, your back, all the way up to the bra strap, you guys, okay? So all the way up to right here where the bra strap usually is. Sorry, I have hiccups. Is where, you know, the full lipo would be. The reason why it's called lipo 360 is because a 360 is a full circle, right? So that full circle, it's a full circle like this, you guys. It literally gets absolutely everything from your whole front abdomen area, your lower part, you know, like the fupa, your middle abdomen area, your top abdomen area, where we can get like some little rolls right here, your flanks, your whole entire side like this, the love handles, you know, the lower part of your back, the lower fat, the right here, and all the way up to the bra strap, you guys, okay? So it literally is getting absolutely everything that is going on in your abdomen area, okay, you guys? So I'm here to let you know that for the financial plans for a breast augmentation, you can pay as low as $18 weekly or $99 monthly, you guys. For anyone that doesn't know what a breast augmentation is, a breast augmentation is when we use a silicone implant or an implant, saline implant. This silicone implant is a 545 cc's. So this is what 545 cc's looks like, you guys. So you guys can take a look in case you guys never seen what 545 cc's look like. And this is what 520 cc's look like. So you see, oh sorry. So you see this is the difference, 545 I believe, yeah, 545 cc's and 520 cc's, you guys, okay? In case you've never seen, you know, silicone implants. Let me also show you this. You see how I can literally stretch it as much as I want, you guys, and I can literally go like this. I can literally go like this, you guys, like this, and nothing happens. You see how I'm grabbing the implant and my hand is the one manipulating the implant, like the implant is not manipulating my hand? Well, I'm here to show you because, you know, on social media, on the internet, when we're trying to educate ourselves on the topic, it's okay to want to learn and to want to educate yourselves on the topic, you guys, but it's really important to know where you're grasping this information from. So what does that mean? That not everything we see is true, you guys. So it's extremely important that when we're trying to educate ourselves and we're trying to like find tips and find information about the procedure that we're looking forward to getting, I'm here to let you know, you guys, that it's extremely important to listen to people that are educated on the topic and that actually know about it. Because I see on social media that, oh, when you get a breast augmentation, they feel fake. You guys, this implant is not gonna stop you, like it doesn't stop you from grabbing it. So let's say I had an implant right now. You see that when I grab it, it changes, it shifts shapes as I grab it, you guys, okay? So it's my hand manipulating the implant, not the implant manipulating my hand. Another thing that I wanted to show you guys is that it does not break whatsoever, you guys. Like this like you could step on it, you could literally put your heel on it, you could put your nails. Look at my nails. Look at that. And you see that I'm being pretty rough with it, so you guys can see how indestructible this is, okay? You guys, it's literally designed that way, so it will not break on you, okay? So for a breast augmentation, the different kind of incisions for a breast augmentation could be the following: on the areola, on the under your boob, and on the armpit, you guys, okay? So it's extremely important that we remember, you know, the sizes and like where the incision will be taking place. All of those things, you do have to speak about it with your surgeon, since, you know, your surgeon is going to be the one knowing what where your breast tissues like, your skin elasticity, what's the best size for you. And, you know, about the incision, you and your surgeon can discuss that during your free virtual consultation or your free in-person consultation, you guys, okay? So like how I was saying, for a breast augmentation, you can pay as low as $18 weekly or $99 monthly, you guys. For Lipo 360, you can pay as low as $18 weekly or $99 monthly, you guys. So Lipo 360, the reason why it's called 360 is because it's a full circle. So that's exactly how the liposuction takes place. It's a full circle of your whole front abdomen area, your flanks right here, your sides, and your back, all the way up to the bra strap. We're also going to be getting that fupa and the love handles, you guys, in case you were wondering. So the financial plan for a Lipo 360, you can pay as low as $18 weekly or $99 monthly, you guys. For a tummy tuck is what repairs the abdominal muscle, does lipo on the flanks. You know, a tummy tuck is what we'll be using when we are experiencing some excess skin, or when we look at ourselves in the mirror and we see that our belly button kind of looks like it's hooding down, or it kind of looks like a sad face. All of these things will be great indications that you will be an amazing candidate for a tummy tuck, you guys, okay? So you may be wondering, well, why is it necessary to repair the abdominal muscle during a tummy tuck? So you guys, if your abdominal muscle needs to be repaired, it will be repaired, because let me explain. The abdominal muscle is important for the surgeon to repair it if it does need to be repaired, because that's what allows the outside of your abdomen, you know, like your stomach, to look flat. So for us to have that beautiful flat abdomen, we do have to have the the muscle abdomen repair, okay, you guys? So the tummy tuck you can pay as low as $18 weekly or $99 monthly, you guys. So a mommy makeover, what it consists of is a tummy tuck, you know, what repairs the abdominal muscle, does lipo on the flanks. They stretch out that skin, they make sure that your belly button is well nice and centered and symmetrical with the rest of your body. Then they remove the excess skin and then they move along to the breast. So the mommy makeover also consists of a surgery on the breast of your preference, of your liking, which are the following: a breast augmentation, a breast reduction, a breast lift, or a breast fat transfer. In case you're wondering, well, what if I want to get a breast lift with a breast fat transfer? Can I do that? You absolutely can, you guys. Here at Icon Cosmetic Center, we can do that for you and more. Let's say another example, let's say that you want to get a breast augmentation with a breast lift, you know, for more upper pool fullness, you want more projection, when you want more side boob, more cleavage. It is important that we remember that that's what you can also get that done. A breast augmentation with a breast lift, you can also get that done, you guys. So for a mommy makeover, you can pay as low as $39 weekly or $149 monthly, you guys, okay? So for a labiaplasty is a surgery that is performed on the outside part of the lips, so on the labia lips and on the clitoral hood, you guys. So when you, for example, when you are doing intimate moments, like intimacy time, and you can't seem to focus on what's going on in your surroundings because you're constantly thinking about, okay, what's going on with your situation right there, I'm here to let you know that you don't have to keep suffering in silence, you guys. This is something that you don't have to keep on and on and on suffering. Like, you can permanently fix your issue by getting a labiaplasty. Or also, it could be for somebody that, let's say you wear a certain type of underwear, certain type of pants, certain type of clothes that are just extremely uncomfortable for you. I'm here to let you know that you can use the labiaplasty to rejuvenate the area, and you can also use the labiaplasty to remove some skin from the labia lips and from the clitoral hood, okay, you guys? So the financial plan for a labiaplasty is the following: is $18 weekly or $99 monthly, you guys. That is so affordable. Like, I'm telling you right now, in no time you'll be popping out with your new body, with your new BBL, with your new vagina, your new breast. Like, I'm here to let you know, you guys, that this is something that if this bothers you and stuff like that, like, you don't gotta be putting up with that. You could do something about it, okay, you guys? And with the help of our financial plans, with the help of everything that we have to offer here to you guys, your deposit getting multiplied times 2, your $250 deposit now is gonna be getting turned into a $500 deposit. Like, I'm just here to let you know, you guys, that with all these amazing promotions, what are you waiting for? Don't fail yourself. Don't let yourself down. Leave your information right here, you guys. In my left bottom corner in this blue folder, put your name, your phone number, and your email, you guys, okay? Very, very important that you guys do remember that information, so that way we have direct contact and we can reach out to you, okay? So, like I was saying, for a tummy tuck and a BBL, the combination of both procedures together. By the way, yes, you can combine procedures. You can combine a BBL with a breast augmentation. You can combine a tummy tuck with a BBL. You can combine a liposuction with a breast augmentation. You can combine a vaginoplasty with a BBL with a breast augmentation, you guys. There's plenty of different ways where you can combine your procedures. So, for a tummy tuck and a BBL, the combination of both procedures combined, you can pay as low as $39 weekly or $149 monthly, you guys. When I'm telling you, this is so affordable, it really truly changes the game for us. In no time, you'll have your new banging body. In no time, you'll become an iconic doll. And I am here to let you know that these financial plans are so affordable, and it really does help us, you know. It really does make a difference for us to finally take the next step into getting our surgery, you guys, okay? So for lipo and breast augmentation, the combination of both procedures, you know, this is another perfect example of the way that you can combine procedures. Okay, so for lipo and breast augmentation, the combination of both procedures, you can pay as low as $39 weekly or $149 monthly, you guys, okay? So the companies that we do these financial plans with are Alpha on Credit and Care Credit, you guys. When I'm telling you that with the help of these financial plans, with the help of the 2 extra areas of free lipo, with the help of our deposit getting multiplied times 2, so now we don't have a $250 deposit, now we have a $500 deposit. That, of course, will be going towards our surgery, and this applies for every single surgeon and for every single procedure, you guys. So when I'm telling you, you ain't never seen a promotion like this one, with an amazing clinic, you know, having all of these great surgeons that are all board certified, that all have over 10 years of experience, you guys. I'm telling you right now, it's your your time to shine. Take advantage of all of these amazing promotions. And don't let yourself down, you guys. You know, like, I get it. You know, sometimes life gets in the way and sometimes we got to postpone things. But I'm here to let you know it's 2025 and you can receive it with a new banging body, you guys, okay? I'm here to let you know that you could enter a new era of yourself, and, you know, you don't have to keep putting up with the things that bother you, you guys. You could come in for a free virtual consultation, a free in-person consultation. So with that being said, leave your information right here, you guys, in my left bottom corner in this blue folder. Put your name, your phone number, and your email, whatever's the best way to get in contact with you guys. That way we can get in contact with you, okay? I'm here to let you know that your time is now. The time is today. So what are you waiting for? Don't let yourself down, you guys, okay? So like I said, thank you guys so much for joining the live today. And don't forget, leave your information right here in my left bottom corner in this blue folder. Put your name, your phone number, and your email, you guys. That way we can get in contact with you, okay? Thank you guys so much for joining the live today. We'll be coming back very soon doing lives with all of our amazing surgeons. And by the way, you guys, for all of the people that said that they loved the live with Dr. Tamer, don't worry, because we are coming in hot with lots of more new lives. And, you know, whatever question we didn't get to, you guys, we're always going to make sure we're answering all of your questions throughout every single one of our lives, okay? Thank you guys so much for joining the live today. I hope you guys are having an amazing rest of your day. And we'll be coming back very soon. Thank you so much for the gift, you guys. Thank you so much for the finger heart. Throwing one right back at you, girl. Thank you so much. We'll see you back very soon, okay?